we know that the lower esophageal sphincter is actually predicated upon three major components of anatomical constancy. In order for the lower esophageal sphincter to maintain proper competency, the lower esophageal sphincter, or the distal part of the esophagus, has to extend into the abdominal cavity at least 4 centimeters. The diaphragm cannot have a hiatal hernia associated with it, which is a splaying apart of the right and left crucis of the diaphragm. Thereby, there is no more extrinsic compression sitting against that esophagus. And finally, we want the orientation of the esophagus and the stomach to be maintained, and this is what we call at that area of the angle of His. In many patients, when they develop hiatal hernias, what occurs is that segment of the esophagus, which should be in the abdominal cavity, has now been dislocated up into the chest cavity, thereby causing a dysfunction in the pressurization of the bottom of the esophagus. So in many of these patients, simply taking medications may not be appropriate treatment, or more importantly, adequate treatment to control their symptoms. Some of these patients may consider surgical treatment for the hiatal hernia, which reduces the actual symptoms in patients about 92%. These surgical corrections are performed minimally invasively, with small incisions about 0.5 centimeter to 1 centimeter in diameter. Most of these patients actually go home the same day as well. The anti-reflux mechanisms can be anything from Nissen fundoplications, partial wraps such as door fundoplications or two-plate fundoplications, or even newer technological advances such as the Lynx magnetic system as well. The Lynx magnetic system is done minimally invasively, with small incisions measuring 1 centimeter to 0.5 centimeters. Many of these patients can actually go home the same day, so it can be done safely as an outpatient procedure. At John Muir Health, we have a very high volume of implantations, and we may be actually one of the largest centers in Northern California that performs these procedures. I'd like everyone to address potential causes for heartburn and reflux in many of these patients. These are in the form of hiatal hernias, which is a possible cause of the heartburn and symptoms that patients may feel. I thank everyone for their time today.